Hey guys, my topic for the research paper was scoliosis, and I'm going to do my presentation over what scoliosis is, the four types of it, how it presents itself, and we're just going to, first off, we're going to define what scoliosis is. Scoliosis is a frontal curvature and a lateral deviation of the spine. The normal and healthy spine is straight in the frontal plane and curved in the sagittal plane. The normal curves of the spine include the outward curve of the upper back, which we know is the term of the kyphotic curve, and then the inward curve of the lower back, which we know is the lordosis curve. A scoliotic spine deviates away from the midline and away from these normal curves. So instead of having a vertically straight, curved spine, they have lateral curvature of their spine. So what does scoliosis look like? This obviously is a normal spine. It is straight and has those curves, but we can't see them by the picture because they're straight. And then this is a scoliosis spine. You can see that lateral deviation away from midline. And we'll talk about in a second, but this is a right curvature scoliosis. And then here is an x-ray to see, you can see the same kind of curve going on on this image. So the parameter of scoliosis, like what is considered scoliosis. Scoliosis is classified as right or left depending on where the convex side of the curve is located. So if you can go back to that last slide. So this would be a right scoliosis because the convex side is on the right side, and that is what signifies. So if this convex side was on the left side, this person would have left scoliosis. So like I just said, if the convex side is on the major curve to the right, then an individual has right scoliosis. Opposite, if the major convex curve is on the left side, they'd have left scoliosis. The severity of scoliosis is determined by the Cobb angle. So what is this Cobb angle? The Cobb angle is the angle formed by the two most dispositioned vertebrae of the bent spine. So the two vertebrae that are most out of alignment, the angle that those two vertebrae form. The individual must present with a spinal curve or this Cobb angle greater than 10 degrees to be diagnosed with scoliosis. So some people may have slight deviations and have less than 10 degrees. We all, maybe not have a perfect straight line, but it has to be 10 degrees to be actually diagnosed with scoliosis. Cobb angles greater than 50 degrees tend to worsen even after full skeletal maturity has been reached and will more often have to be corrected by surgery. So that's just kind of, at 10 degrees is the minimum and 50 is kind of like the max of, if when it gets up to 50 degrees, you're going to more than likely have to have some kind of surgical intervention because just passive movement and different braces aren't going to fix that. So here's just a few pictures I found to kind of visualize the Cobb angle. I know it's kind of hard to think about, but this shows, this is the first most deviated vertebra, and this is the second. And so they have two lines drawn from them, and the angle that they form right here is the Cobb angle. There's kind of like a severity list of the Cobb angle. So a mild Cobb angle is from 10 to 20 degrees, and a moderate Cobb angle is from like 21 to 40. And then if you have severity, like a very severe Cobb angle, which would be greater than 40, greater than 50, those are just kind of the mild to severe on the scale. So now we'll get into the four types of scoliosis. There's other types, but these are the four main types. And so the first one we're going to talk about is idiopathic, second is non-structural, third is congenital, and the fourth one will be neuromuscular. Non-structural scoliosis, is also termed functional scoliosis, is temporary and reversible. This type of scoliosis can be corrected passively without any anatomical changes to the vertebra or disc, and by that just means surgical intervention. non-structural scoliosis can be treated with bracing and like passive movement, so physical therapy, working with individuals, stretching different ways. Non-structural scoliosis is most frequently caused by lower limb length differences, so one leg being shorter or longer than the other. Walk continuously, living your day-to-day life with that difference can cause definite change in your spine. Unilateral paravertebral muscle contracture, antalgic response to disc herniation, so that pain that they're having on whichever side, and they'll compensate to the other side from that pain, and that can cause deformity. Upper limb asymmetry, so one arm's longer than the other, and just overall poor posture. All of these can cause non-structural scoliosis. I mentioned bracing. This is a great picture of before and after. To the left is an x-ray and a picture of this individual that had right scoliosis. This is before bracing, and this is after a period of time of wearing this brace. And you can see the definite difference and the correction of that bracing did for that individual. So idiopathic scoliosis, unlike non-structural, idiopathic is irreversible. Idiopathic scoliosis is also the most common form of scoliosis, making up about 80% of all scoliosis cases will be idiopathic. Idiopathic scoliosis is believed to be a condition that has many factors, including a hereditary component, but overall etiology is still unknown, hence idiopathic. Severe idiopathic scoliosis patients present with large curves, severe rib humps, and rib hump is kind of like, even though the torso will be to the right or left, whichever side that they're leaning towards will have this rather large hump. It looks like the ribs, but it's really just because they're poked out more on that side. They'll have severe trunk imbalance, and they'll even have cardiorespiratory complications due to that leaning or curvature of that spine. It forms compression on your lungs, on your heart, which causes those complications. Idiopathic scoliosis can be managed with bracing to help stop or slow the progression during the growing years. Bracing can't completely correct idiopathic, or most cases can't completely correct it, but you'll get a greater correction if you include that bracing in during the growing years, because the spine is more malleable. Then once they reach skeletal maturity, that curve's just going to get worse, and you can't really, manipulate that too much. This form of scoliosis often requires cervical intervention just due to that. A lot of cases aren't found until after skeletal maturity has reached, and so a lot of times bracing and stuff like that can't fix it, so you'll have to have surgery to fix the curvature. So here's an example of a curvature correction. This is before the operation. You can tell that she was severely had right scoliosis. Even though her shoulders are still in line with her pelvis pretty good, you can see that curve. And then this surgery had metal implants. They're called metal pins, and they put pins in to straighten out. And you can see that even her, in both the x-ray and the picture of her, that surgery really helped straighten her out. So the third type is congenital scoliosis. It occurs when there is a deficient embryological vertebral development. This usually occurs in the first 6 weeks of fetal development. Congenital scoliosis is the presence of spine abnormalities in the spine at birth and are often accompanied by organ malformations. So you're born with those spine deviations, and a lot of times whenever as the baby grows, that compression just has an overflow of malformations of the organs and other developmental things. And the defects are categorized by failure of formation, a failure of segmentation, or a combination of both formation and segmentation. In congenital scoliosis, if there is a complete formation failure of the spine, it will result in a hemivertebra, and which causes asymmetrical growth and deformity. 25% of all congenital curves will not worsen. That will just stay the same. 25% will show mild progression, and 50% will progress at a rapid rate and require treatment interventions such as bracing or surgical intervention. Our fourth and final type of scoliosis is neuromuscular. This form of scoliosis occurs in individuals with neurological or muscular disorders. Neuromuscular scoliosis is technically a symptom that's encountered in patients who have or are suffering from neuromuscular disorders. So, due to the disease that they have, it causes neuromuscular scoliosis. So, some of these disorders that can cause it are cerebral palsy, muscular dystrophy, and spinal atrophy. So, just that this is just a symptom, if you will, but more of another complication due to these disorders that these individuals have. Neuromuscular scoliosis can cause complications such as pelvis asymmetry. So instead of, like in the picture of that young girl earlier, her shoulders and her pelvis were still in line, a lot of times neuromuscular scoliosis patients will not have that pelvis symmetry. Their pelvis will be tilted. They'll also have skin breakdown and pulmonary compromise and just overall functional decline. Skin breakdown is due to just a lot of these patients are dependent and can't move on their own. So by having, not normal pressure points for ulcerations will be different, and just aids in their functional decline. So thank you for watching and listening to me talk about scoliosis, and hope y'all had a great time researching your topics.